I'm joined by my colleague, Uzoma Asaguera, who is the official opposition health critic, and we're here to respond to the announcement made by Dr. Roussin and the health minister. I want to begin by saying we have to abide by what Dr. Roussin is asking of us. It's an important time, record high numbers in terms of the pandemic, Manitobans being sent out of province. We really have to respect the health orders that Dr. Roussin is putting into place. And so I want to say that unequivocally right off the top. At the same time, I think I'm feeling like a lot of Manitobans today, which is I'm feeling very frustrated. I'm feeling frustrated by this government because once again, we as Manitobans are being asked to step up and make further sacrifices, and yet I don't see the government matching that with the action that is needed, which is getting urgent supports for our healthcare system. Throughout the spring, these restrictions have been ramping up, and every single time, Manitobans have been stepping up and saying, yep, okay, I'll abide by those new heightened restrictions. And the reason why they're doing that is because they assume that we're buying time for the government to put supports in place to strengthen our healthcare system. And that hasn't happened. So that's where the frustration is coming from. It is crystal clear what needs to be done today to help the situation in the ICUs. We can't hire and train staff overnight for the ICUs. The only way we can get those reinforcements is if we ask for help from the other provinces. So why didn't the Premier, the Minister of Health, why didn't anyone come out today and said, you know what, rather than sending sick ICU patients to Ontario, we're going to bring nurses in with ICU experience and expertise into the province from other jurisdictions? I think that would have made these restrictions a lot more forceful. Because to be frank, when the government takes advantage of the good nature of Manitobans who want to abide by the restrictions, and takes advantage of that by failing to act, by bolstering our healthcare system, that government action undermines public health. I also want to call out this government for continuing to blame Manitobans. In their press conference, we saw a continuation of blaming Manitobans for these numbers instead of accepting responsibility for the fact that this PC government failed to act. But I think they hit a new low today too, when they started to push this narrative about how many people in hospital right now are not vaccinated, while completely ignoring the fact that this government had a painfully slow rollout of the vaccine campaign throughout this year. What am I getting at here? This is what I'm getting at. You could have done everything right when it comes to the vaccine. You could have been willing to get a vaccination. You could have waited your turn. You could have booked an appointment as soon as you were eligible and had to wait that 2 to 3 weeks before your appointment came up and unfortunately got COVID in the interim. So the government's out here rushing to share people's personal health information about their vaccine status. Why don't they tell us how many of those folks in hospital actually had a vaccination appointment booked? Why don't they tell us how many of those folks who are in hospital were willing to get vaccinated, but it was not accessible to them? So again, if we're all in this together, we can't have a government that's blaming the people. We have to have a government that's acting to protect Manitobans. And so yes, I support the public health orders, I support Dr. Roussin's asks, but I am begging this government to take action and help the situation in ICUs. Put your pride aside and invite, ask, request, demand, whatever the appropriate verb is, but get some darn ICU nurses here in Manitoba from other jurisdictions. This is the goodwill of Manitobans. This is what they're doing. This is why we're making sacrifices. This is why we're not going to see our family and friends this long weekend, to buy this government time to fix the mess in the healthcare system. So don't take advantage of that sacrifice Manitobans are about to make this May long. Use the time that Manitobans are buying you to get reinforcements in to help our healthcare system, which is in a desperate state right now. So again, we support public health, but of course I think we all have to recognize at this stage of the pandemic, so it's normal. It's all right to feel a little bit frustrated. So I'll invite my colleague up.